Good morning. Welcome, Black Health Matters family and friends. My name is Leslie Fontenot. I'm the Senior Marketing and Operations Director for Black Health Matters. And I'd like you to welcome you to this session on preventative health. Preventative care is important because it helps you stay healthy and access prompt treatment when necessary. And it can also help reduce your overall medical expenses. Stay healthier, and get more effective treatment. Many types of screening and tests can catch a disease before it starts. Today, we'll have Dr. Jeffrey Sterling, President and CEO of Sterling Initiatives, his own company. He's a healthcare consulting and implementation firm assisting entities across the country and beyond the US borders with incorporating best practices, among them health system, health plans, state governments, and medical practices. I'd like you to help me greet and listen to Dr. Jeffrey Sterling. Thanks for joining us, Dr. Jeffrey Sterling. I'll let you have it at this.
Hope that everyone is doing well. We're going to do a couple of things in a relatively short amount of time. We're going to do a 30,000-foot overview of the concept of health promotion, but more importantly, and much more interestingly to you, we're going to do some empowerment. So we're going to give you some tools that you should be thinking about and putting into play in terms of your own health. First things first, let's talk about health prevention and promotion in the United States relative to the rest of the world. One of the interesting things about our healthcare system as we describe it is that I would actually suggest to you that we don't have a healthcare system in the US. We really do have a healthcare industry, and it's one of the things that serves as the economic engine of the United States. One of every $6 spent in the United States is actually spent on healthcare, and that's what keeps our economy pumped up and why we actually are so emotionally attached to maintaining the system the way in which it is. If you can imagine that we're just interested in economics, which is all true. If you look at the political landscape, you'll come to understand that healthcare outcomes really are just a byproduct of the exchange of commerce. And if you just kind of think about it, look at how much money we're spending per person relative to the rest of the world. The US spends on average on an annual basis over $11,000 on healthcare, which is about 50% more than any other country. And twice that, almost twice that of the, actually it's more than twice that of the average, as you can see there in the blue line of $5,500. As I mentioned, our gross domestic product is fully 17%. Healthcare is fully 17% of our gross domestic product, whereas most of the countries that I do work with are only spending between 2 to 4% of their gross domestic product. But when you factor in other advanced economies, particularly on the technology, and you'll see that the average is about 8.6 around the world. This is important to us because if you're spending $11,000 a year per person on healthcare, there's many individuals in the United States that simply can't afford that amount of largesse. And too often they look like us. We are the individuals that are most disproportionately affected by healthcare measures, and that's what we call healthcare disparities. These differences shouldn't exist. And really it's simply because we have diminished access to care, a reduced relative quality of care, and because the cost of care is so prohibitive. There are things that just shouldn't be the case, and our goal is to fight for changes that reduce and eliminate these healthcare disparities. Now look at this slide. I have no interest in you reading this slide. I'm not going to go over what's on this slide. I just want you to see how much of a mess it is when you actually look at the ways that healthcare disparities affect the African American and Black experience in the United States. If there's a disease, you can rest assured that it's affecting Black folks more than it is the general population. And if anybody's interested in the details of the slide, we certainly can get it to you. But I just wanted to show you how overwhelming this entire concept is. But the bottom line is that here's the healthcare disparity that you're concerned about: life expectancy. That's the ultimate in healthcare disparities. If you look at the chart, just go all the way down to 2017, you'll see that a Caucasian female actually ends up having a 3-year greater life expectancy than an African American female, and a Caucasian male has about a 5-year greater life expectancy than a Black male. That's ridiculous. If you want to go to an extreme just to really prove a point, Look at the difference in life expectancy between a black male and a white female. That's fully 10 years. We have to do something about that. We have to eliminate healthcare disparities whenever we can. Now, you all know that an ounce of prevention is worth a pound of cure. You've heard that forever, but how often have you actually thought about it? How often have you actually seen that put into play? My organization, SIMCO, is America's first managed preventive healthcare organization, and it's all about empowerment. You cannot rely on sick care. You cannot rely on hospitals to deliver solutions. If you're waiting until the time in which you're sick to worry about your health, you've missed the boat, and you are apt to experience much worse healthcare outcomes than you otherwise would. So this conversation is about healthcare empowerment as a means of eradicating healthcare disparities. It is absolutely ridiculous that we would think that RC and our primary care physicians once a year is a good enough equation for us to deliver adequate healthcare outcomes. What are we supposed to do those other 364 days out of the year? Well, the answer to that question is that we are supposed to be better stewards of our own healthcare, but we need to know how to be empowered and how to take advantage of things such as the most basic of preventive healthcare services. If Americans in general are only using healthcare services about half the recommended amount, what do you think that says for African Americans? We have to suffer through healthcare deserts, medical deserts, where there aren't physicians, where there aren't hospitals, and where services are lower than they should be. This is a very real thing. And 7 out of 10 deaths attributed to chronic diseases that we suffer in a disproportionate manner to the greater population are things that are preventable. So if our community would embrace health prevention and really adapt health promotion, it would dramatically improve our life expectancy and the quality of our life as we go along. Hard stop there. I've just drawn a direct line for you. Preventive care is the way to increase life expectancy. Do not wait until you get sick and show up in an emergency department and expect us to perform miracles. By the way, it wasn't mentioned, I've been an emergency physician for over 25 years. So I've seen these stories all day, every day for a long period of time. And trust me on this one, an ounce of prevention is worth a pound of cure, again and again and again. Very simply put, I just want to spend some time talking to you, and I'm going to give you 25 tips. I want you guys to play along at home, and I want you to check and see how many of these 25 tips actually describe the way in which you're living your lives. If this is not the case, I want you to take notes. These are very simple things that if you actually are living your life this way, quantifiably will increase the quality of your life. This is the fountain of youth, folks. This is not anything that you have to look into some mysterious blog and figure out. These are things that you should know. These are things that have always been right in front of us, but taken in total, they will do a wonderful job in increasing the length of your life and improving the quality of your life as you go along. So let's get into these 25 tips. It's about health empowerment. Number 1, get up. If you actually just walked, people always talk about exercise and engaging in these complex physical fitness routines. It's not that complicated, folks. If you just get up and take a walk 3 times a week for 30 minutes, the sum total is that you will strengthen your heart to the extent to where you will reverse your age by about 10 years, okay? None of these things are opinions. This is all data-driven. These are all qualitative facts. I always like to tell my patients, get off your butt and close your mouth. Well, this is the get off your butt portion of the program. 3 times a week, take a walk for 30 minutes. Hopefully everybody who's paying attention has checked this off and you're 1 for 1 in terms of your preventive health score. Number 2, eat more fish. And no, I'm not talking about a Friday night fish fry. I'm talking about something that's baked or boiled. Doing so once or twice a week actually can reduce your heart attack risk by 1/3. A lot of you out there will say, well, I take fish oil, and that's good, but nothing is better than these things in their natural state. So start eating more fish. Not talking about fried fish, not talking about filet of fish, talking about some good old-fashioned baked fish. Incorporate it into your lives. Number 3, learn how to lift weights. And again, I'm not talking about changing your body to where you look like Schwarzenegger, just a routine toning series of exercises really can improve your function, your muscle function by about 20 years, even if you're in your late 50s or in your early 60s. Just get in the routine of getting you some 10, 15, 20, 25-pound weights, depending on how big you are, and go through the motions. This is something that's very important. I think you'd find to be very helpful. Number 4, get a pet. It's a very easy way to avoid depression. And by the way, again, I'm being facetious here, but those of you that are married, you can approximate that same concept if you are happily married. So find someone that you can show love to, and that'll help you avoid depression. Mental health and the stress that it produces is a massive contributor to diminished lifespan and to a lower quality of life. Find a way to avoid that. Number 5, hydrate. In our native states, our body is almost 70% water. Drink water whenever possible. You know, this thing with sugary sweets is that it's a habit. You can break the habit. Your body actually does crave water. And the more you crave water, the more it's a testament to how good in shape you are. I'm not talking about soda. I'm not talking about clear pop. I'm talking about water. And by the way, you know, we have additional conversations about coffee and wine. They actually both do produce beneficial cardiac effects. The thing about coffee, of course, is that we put so much sugar and cream in it that it negates the types of effects. But this conversation is about water. Whatever you need to quench your thirst, pick up that water bottle and go for it. Number 6, don't die in a fire. Make sure that your home is equipped. It's actually the law that you should have a functioning smoke alarm, carbon monoxide detector, and fire extinguisher. Everybody in your house should know how to use them. This is not that hard. None of these tips really are that hard. The challenge is, are you implementing these strategies? Number 7, 1,000 people die every single year in the US because they don't have a helmet on their head. If they're scooting, biking, or riding in a motorcycle. There are even folks that die from skydiving accidents because they don't have a protective helmet. Sounds silly, but it actually happens more than you would suspect. I'm an optimist, you be an optimist. Tomorrow always has the promise of being a better day. Get with the program. Stress kills, and absolute stress kills absolutely. Learn how to look for good. Some people focus on the obstacles, others focus on the opportunities. Learn to be optimistic, and it'll improve both the quality and the quantity of your life. This should be easy. At some point in your life, you've eaten enough steak, folks, and enough bacon, sorry to say. But if you just reduce your red meat intake by 1 portion the size of your fist, you will improve your life expectancy by 13%. So if your life expectancy is 70 years old, that pretty much amounts to another 8 years that you're going to decide to live or not live based on your red meat intake. Please think about that. You can mix it up. You know, you don't have to be a vegan necessarily, and you can do things in moderation, but you can take those first steps toward reducing your red meat intake, and it will deliver benefits to you that are quantifiable. 13% of your life is a lot. Social networks are important. Now let me adapt that. Positive social networks. There's been a lot said about the negative and deleterious effects of social media if you choose to stay and engage in the environments that are just argumentative. Don't do that. We're talking about healthy social networks. They really can add as much to your life expectancy as the types of things that you do by diet, exercise, and taking medicine. Just you are the average, as we say, of the 5 people you surround yourself with. And if you're surrounded with negativity, that's going to produce more stress, which is going to eat at you and eliminate the benefits of a positive life outlook. Get better friends. That's one of my New Year's resolutions every day. I don't wait till the end of the year. I always say I want better friends. And by definition, that means people who are positive and bring me happiness and joy. Be generous. Pass your blessings forward. Everyone has something to offer someone that's less fortunate than them. This is something that is clear. If you have a generous heart and you are a given person, you actually end up being in better health. There is joy that translates into release of hormones inside of your body that promote happiness and well-being. Be a blessing. Do something for someone other than yourself, and it'll make your life better and it'll help you live longer. Sleep. You know, you actually do need sleep. When you sleep, that's when your body repairs all of the injuries that have occurred over the course of the day. That's when your brain files its memories and you get ready for the challenges that are ahead of you. 7 hours a day. If you've ever needed to quantify the number, you really need to get an average of about 7 hours a day of sleep in order to have your body functioning optimally. Get with that program, take care of yourself, get your sleep. Now here's something that I bet a lot of you aren't doing. Discover Blueberries. A lot of us are going halfway around the world trying to find miracle cures and other such quack endorsed solutions. But this is simple. If you actually engage in eating blueberries and nuts, this gets to part of what's inside of us that helps us repair injuries. You may have heard of the term superoxidants. You may have heard of superfoods. Blueberries actually are amongst the most efficient tools, efficient foods that work toward that end. And we're talking about 2 cups a day. And this is enough to turn some of those chronic diseases around, reduce depression, and actually improve your memory. Think about it, just get in the habit of engaging in twice a day, getting a couple of blueberries, whether dry or just start munching on them. I think you'll enjoy the benefit. And yes, same-sex orgasms. Orgasms are very important. It actually helps you burn calories, reduce stress, induces sleep, and yes, it releases endogenous opiates that help you reduce pain. And believe it or not, AIDS is still around, folks. People are still dying and having diminished quality of life from not engaging in self-sex. Please wear condoms. Please engage in monogamous sexual habits or abstinence if you can't do so. It actually matters. I mentioned the blueberries. Your other snack of choice really should be a handful of nuts, healthy, unsalted nuts. Once you develop that habit, really add to your life expectancy, and it's quantifiable. We're talking about 3 years to your life if you just start to enjoy almonds, cashews, and pistachios. Very simple thing, big benefits on the back end. Who can't use an extra 3 years of a healthy, happy life? Get up, not just that 30-minute walk that I mentioned previously, but if you have a desk job, you really need to make sure that you're taking breaks. Take breaks to get up and stretch, to walk around, and one of the things that I've become in my own business life is that the phone long time and make different benefits and, as I said, close your mouth, get a touch. It helps. This is about as esoteric as I'm going to get with you, but vitamins should be an insurance are engaging in healthy eating. If you're eating healthily, you really shouldn't have to use supplemental vitamins. But if you are going to do so, especially if you're just using something like a vitamin, this is what you should be looking for. And here's one slide in particular that you won't memorize. We all start screen. There we are. 4,600 international units of vitamin C per day, 400 international units of vitamin E, 6 milligrams of vitamin B6, which is important in this era of COVID, a gram of calcium per day, and 400 micrograms of folic acid. Think about it, use it, enjoy the benefits. Pressure. Think about what blood pressure actually is. We're literally talking about the force that your heart needs to contract, the force that your heart has to beat up against in order to deliver blood around the body. It stands to reason if that pressure is high, if your heart, is having to force blood around the body, that is strain. And with strain comes stress, and with stress over time comes failure. That's basically what heart failure is, and why you need to maintain a blood pressure that is low and a heart rate that is slow. If your heart rate is slow, that means it's able to deliver blood around your body more forcefully with each pump. And if your blood pressure is low, then you're doing it more efficiently, and it doesn't have to be herky-jerky in delivering blood with its oxygen and nutrients to the distant parts of your body. The target number these days is still there are normal blood pressures, and that's what is a quality excellent. If you are eating and diet and exercise, you literally can work yourself off of any high blood pressure. Put down the salt shaker, please. Taste your food before before you season it, it helps your blood pressure. Lengthen is a pretty important one. It helps you function as much as 25 years younger than someone who has a high blood pressure. That's just so much better for your life if you get around to focusing in this way. Go for it. Get your blood pressure down. It's not just brushing your teeth, folks. You have to floss. People don't appreciate the extent to which your gums are the portal of entry to various dangerous parts of your body. The blood flow, this is just an incredibly well populated area of blood vessels. And when your gums are diseased, it carries all types of things to your heart and other parts of your body. Brushing and flossing really improve the quality of your life and keep you disease free. 6 years, that's a lot. Pull out that floss, do this 2 or 3 times a day, folks. It's important. We talk about it for a reason. Again, let's actually talk about quantifiable numbers. We've more or less won the war with wearing your seatbelt. There was a point in time in the 70s and early 80s where that was such a fight along the same lines that we talk about wearing masks today, but we've won that war. However, just look at this. If you learn to drive within 5 miles of the posted speed limit, your life expectancy is going to go up 3.5 years. Speed limits exist. The disease and trauma that occurs as a result of driving at high speeds is something that is serious. Speed kills, and speed and motor vehicle collisions and crashes is something that absolutely kills. Limit your speed. You'll get there soon enough. Fiber. Here's a number for you. Start looking at the back of your snack bars if you eat them, or learn while we say an apple a day will help keep the doctor away. If you get 25 grams of fiber in your diet every single day, your function is improving several years. And, all the rage, we always joke about why do elderly individuals eat so much oatmeal. Is directly related to this. If you engage in a high fiber diet, it actually is going to improve your function in direct and meaningful ways. The number is 25. Start counting your calories and count your fiber intake. See if you can get those 25 grams in every day. Laughter. Laughter is the best medicine, folks. It does strengthen your immune system. Again, I'm not talking about your health. I am talking about specifically strengthening your immune system because it affects the release of certain hormones. Learn how to laugh at yourself, learn how to laugh at your friends, learn how to tell a joke, learn how to take a joke. It actually matters. In the ongoing commentary about diet and exercise, diet is about 75% of the conversation. Every time I hear someone talk about a detox scenario, it just immediately makes me ask, why would you need to detox if you didn't tox in the first place? Garbage in, garbage out is really a thing. The more fruits and vegetables you eat compared to red meat, the better your life expectancy is going to become. We already talked about that red meat. 13% life expectancy is what you're either going to gain or lose by how much red meat you take in. Learn to embrace fruits and vegetables. Fruits actually should be your substitute for dessert. You really can do these things in moderation. Why would you ever eat a dessert that you aren't absolutely loving and enjoying? Get out of the habit of just putting bad food in your mouth just because it's there. Love fruits and vegetables. It's just as sweet as anything else if you prepare it right. And here's the point of all of this. You have to learn to be a better steward of your own healthcare. You have to learn how to consume information and advice and customize it to your own situation. You aren't going to become Dr. Google or get a medical degree from Facebook, but you have to learn how to utilize your medical home, your primary care physician. You have to know when the appropriate time is to use the emergency department. You have to understand that prevention goes beyond just knowledge. It gets into getting vaccines, getting screenings. Breast cancer is a thing. Prostate cancer for men is just as bad. If you get screens, the earlier the things are detected, the better your outcome is going to be. You can't fear the disease. You can't fear the screening and the vaccine more than you fear the disease. That's an incredible mistake that we make all too often. And unfortunately, it's not sometimes a mistake. It's just the fact that we have diminished access to care and thus can't get the screenings. But in your own individual circumstance, see what you can do to improve the access to services and information that you have in your individual lives. And I would be remiss if I didn't modernize this conversation with you by pointing out how health prevention and promotion is applicable to the era of COVID-19. And very simply, 90% of the conversation, because we don't have a vaccine yet and we don't have functioning preventive therapeutics or medications, are to be found in these 4Ws. Wear a mask, wash your hands, watch your distance, a couple of meters, 6 feet, and warn others if you become exposed to someone that you know has COVID-19, or if you yourself become COVID-19 positive. The thing with contact tracing is that it's vital to save the lives of individuals other than yourselves, and you don't want it to keep circulating in the population. So wear a mask, wash your hands, watch your distance, and warn others. And finally, hey, just when you think you have it all figured out, you don't look both ways when you cross the street and you get hit by the truck. Learn to do the simple things. Don't be so caught up in that cell phone or smartphone that you aren't looking up when you're doing something. Accidents happen, including motor vehicle versus pedestrian crashes. A lot of people die this way, so you take care of yourself. And here are my final thoughts for you. These are very simple propositions, but all of the things that I said are only as effective as you implement them. The name of the game is not knowing what to do as much as it is implementation of these strategies. So your choices have consequences. Everything you put in your mouth is either going to help you or hurt you. Understand that. Take control of your life as best as you can. You don't have to spend $10,000 a year to live a healthy life. There are countries that have higher life expectancies than we do in the United States that focus on preventive health more than they do curative care or sick care. You have to learn how to effectively navigate your healthcare options. What are you going to do when you get sick? Don't wait until you get sick and then panic. Please sit down with your family and discuss things that can be recognizable, like the signs of a stroke or the signs of a heart attack. Have a plan in place. People are good at doing this for things like when they're going to have a baby. Do it for things that are emergencies. If you're living down in Louisiana, have a disaster kit ready for you. If you're in a tornado or hurricane zone or some other such thing, preventive care is everything. Know better, folks. Do better, and then you'll be better. This is not that complicated. I hope you've enjoyed some of these tips. More importantly, I hope you apply some of these to your life, and you'll get there. And we're happy to help you along the way. Thank you for your time, and I'm happy to answer some of the questions that you may have. I don't see my moderator. So what I will do is I will just look at some of the questions. I see somebody is asking me to address the list of vitamins again. So let's go back to that slide. Just a moment. All righty. Basically, your vitamins are B6, C, D, and E. Looks like we're having some technical difficulties here. All right, we're getting to it. There we are. Here's the list. Vitamins C, 1,200 milligrams a day. Vitamin D, 4 international units per day. Vitamin E, 400 IUs a day. B6, 6 milligrams a day. Calcium, a gram a day. And get some of the other things. How can you get the slide presentation? Info at simcoeillinois.com. That's info@simcoillnos.com.
Hello, everyone. I think we're having some technical difficulties at this time. So what we'll do is we'll respond in the chat room so that if you have any questions, we'll just provide a response in the chat room. And just so that you know, this presentation will be available for the next 30 days on this platform. So feel free to tune back in beginning Monday, and you can actually visit any of the sessions that you may have missed, including this session with Dr. Jeffrey Sterling. Thank you so much and have a great day. Be sure to watch out for our next presentation coming up in the next 10 minutes. Thank you.